So the surgery for pelvic organ prolapse can be done vaginally or it can be done abdominally. When we do the surgery vaginally, we use some strong ligaments in the patient's pelvis to help support the vagina. This is a female pelvis, and in the back here is a ligament called the sacrospinous ligament. It's a very strong ligament, and it can be used surgically to help anchor the vagina in a very stable fashion. Also, we have another ligament called the uterosacral ligament, which is in the vicinity of the sacrospinous ligament, right in this area, and that can be used as well to suspend the vagina and help resolve the patient's symptoms. The other way surgery can be done is abdominally, and nowadays we use the robot to do the pelvic organ prolapse surgeries abdominally, which really cuts down on the recovery time and really helps the patients tremendously with their symptoms. And in that surgery, we actually use a mesh, and that is a very approved use of mesh in pelvic organ prolapse repair. The mesh is actually placed in laparoscopically into the patient's abdomen, and now in this pelvis, this is the vagina here, and the mesh is placed on the vagina, and then it is tacked onto the sacrum. It's attached to the sacrum, so it actually pulls up the vagina in a very stable fashion, and it helps repair pelvic organ prolapse. I always tell patients that, recovery is very patient dependent, and most of the time I see that after vaginal surgeries, patients start feeling so much better after a week and tremendously better after a couple of weeks. But I just tell them to take it easy for about a month. Patients who can work from home anytime start working from home a couple of weeks after surgery, or maybe a little bit sooner, depending on how they feel. The main restriction is no heavy lifting, and vaginal rest. And when we do the surgery abdominally, if we do a robotic sacrocolpopexy, that is the procedure which I mentioned, in which we use a mesh to support the vagina to the sacrum, then again, in a couple of weeks, the patients feel so much better. And then I again tell them that take it a little easy for the first month. The healing in the body goes on for 3 to 6 months, but patients start feeling better, much, much sooner. So Holy Cross Health offers a very comprehensive program in pelvic health. We have different subspecialties which work together for the pelvic floor. So I'm a urogynecologist, and I work together with urologists and colorectal surgeons as needed to help resolve the patient's symptoms, because pelvic floor can involve not only the uterus and the vagina, it can involve the bladder and the rectum as well. Holy Cross Hospital at Silver Spring is known as one of the largest GYN volume hospitals in the state of Maryland, and we are taking the expertise to Holy Cross Germantown. We are also recognized as, the hospital also has the COMIC designation, which is provided to the hospital based on surgical excellence.